Welcome to the first of many video lectures about the GI disorders and failure to thrive. I have separated out the failure to thrive. The common nursing diagnoses associated with the GI disorders are listed here. It stands to reason that alteration of nutrition as well as fluid and electrolytes and elimination are appropriate for a gastrointestinal disorder. But when you look at altered respiration, ineffective airway clearance, risk for aspiration, and risk for infection, you might be scratching your head and wondering, how does that fit into a problem with the gut? On the next slide, I'm going to show you the variety of disorders that we're going to talk about that happen to kids, but I'll also explain them as we go here with these nursing diagnoses. Altered respiration and the ineffective airway clearance can come from a disorder called esophageal atresia, where the esophagus does not develop correctly and part of it is actually connected to the trachea instead of going all the way to the stomach. So you can see where that kid would have a problem with breathing. When you have pyloric stenosis, when you have gastroesophageal reflux, that increases the risk for aspiration. Risk for infection, of course, would go along with that aspiration, so they actually have an aspiration pneumonia. Altered skin integrity is a result of acute or chronic diarrhea. The alteration of family process goes along with the congenital defects, things like cleft lip and palate, biliary atresia, esophageal atresia, because this requires long-term hospitalization for these children. The case of biliary atresia, they actually need to have a liver transplant to survive, and so that would certainly put a wrench in your family plans. Altered growth and development can occur with many of the GI problems because the gut is responsible for absorbing the nutrients. Altered body image, actual and perceived, is appropriate for the congenital anomalies as well as eating disorders. But eating disorders was covered in 171, so we're not going to discuss that in peds, but know that it does exist. So here are the two types of problems that I separated the variety of disorders into: the structural problems as well as the functional problems. But do remember that the structural problems will lead to a functional problem as well. So we have our congenital defects, cleft lip and palate, biliary atresia, where the bile ducts didn't form. These children get an operation called the Kasai procedure, which is a temporary fix for the problem. But they immediately go on the liver transplant list, and without it, they will die at a very young age. Esophageal atresia, there is a video up on Blackboard that I want you to watch about that. The acquired defects are going to be the gastroesophageal reflux disease, and although it can occur throughout childhood, it primarily affects the very young, especially preterm infants, where they have poor muscle development and they end up having reflux. You'll see if you go to the NICU that we have these children on reflux precautions. The obstructions that can occur: Hirschsprung's disease, intussusception, and pyloric stenosis. Two of the three require surgical intervention. The Hirschsprung's disease may or may not, but it certainly alters the family process. Functional problems include a variety of problems associated with malabsorption, and this is going to be due to surgical correction, an illness, as well as a disease process. So examples of this would be celiac disease. There is a YouTube video on Blackboard that you need to watch on celiac disease. I'm not going to cover that separately. Short gut syndrome occurs in very young babies, and it can go throughout their lifetime. So they can have what we call an omphalocele that alters their gut, and then also preterm infants or any baby in the NICU can develop what we call necrotizing enterocolitis. So they lose their blood supply to their gut, it necroses, and they have to go in for surgery, and they will literally just cut parts of the intestine off and anastomose the ends together. But it's a very short absorption that's available now for these children. So they have chronic diarrhea, and I'm talking that they have many, many liquid stools all day, every day. I'll never forget this kid that was in chalk. Here he has a nice PICC line in, and we go in to give him his medications, and he's sitting on his dad's bed next to his crib, and there was stool from one end of his dad's bed to the other, and from the kid's head to his toe. And we're looking at this kid like, how are we going to avoid getting a central line infection trying to get this kid his medications? So we had to completely clean him up, and then we accessed his line. He has since grown up, and he's about 4 years old now, cute as can be, but he still has a short gut, but he's growing. Biliary atresia leads to the malabsorption because we don't have any liver function. Inflammatory bowel disease begins in late school age to early adolescence, so this is ulcerative colitis and Crohn's disease. And these are debilitating, both of them. Ulcerative colitis can lead to early development of colon cancer, and Crohn's disease has remissions and exacerbations, and it affects the GI tract from the lips all the way to the anus. And then we have transit problems. It's either too slow or too fast. So if it's too fast, we have diarrhea, and if it's too slow, we have constipation. So this ends part 1 of GI disorders.